Hello, I'm Dr. Robert Clark. I want to ask you a question that might just save your life. Did you know that an estimated 9 out of 10 people with chronic kidney disease don't even know they have it? The reason is simple, yet terrifying. The early signs are silent, subtle, and incredibly easy to dismiss as just a normal part of getting older. But for the millions of seniors living with diabetes, these quiet whispers are not signs of aging. They are a critical warning shot from your body that something is wrong. Missing them can mean the difference between a long, healthy life and a future tied to a dialysis machine. For over 3 decades, I've dedicated my medical practice to helping seniors navigate the complexities of their health. I've sat with thousands of patients, helping them manage conditions like diabetes, and I've seen firsthand how diabetic kidney disease can sneak up on even the most diligent person. The good news is, you are not powerless. Your body does give you clues, and today, my goal is to teach you how to read them. We are going to walk through the 5 most common, yet often overlooked warning signs that your diabetes may be starting to damage your kidneys. More importantly, we'll talk about what you can do right now, from simple things to monitor at home to the specific tests you need to ask your doctor for. Think of this not as a scare tactic, but as a roadmap to protecting your health for the long run. Your kidneys are your body's silent heroes, and it's time we learned their language. The first sign we need to discuss is one that appears in your own bathroom, and it's something most people ignore completely. It's foamy or bubbly urine. Now, I know this might sound strange, but paying attention to what's in the toilet bowl after you go can give you one of the earliest clues about your kidney health. I'm talking about urine that consistently has a layer of foam on top, almost like the head on a beer, or the suds left over from a bubble bath. More than just a few fleeting bubbles that can happen with a forceful stream, this foam lingers. Let me tell you about a patient of mine. Let's call him Frank. Frank was a 68-year-old gentleman with well-managed type 2 diabetes. He came in for a regular checkup and told me he felt great. As we were wrapping up, he casually mentioned, "You know, Doc, the strangest thing, the toilet seems awfully sudsy lately. My wife must have switched to a new cleaning product." That one offhand comment set off an alarm bell for me. It wasn't the cleaner. A simple urine test confirmed my suspicion. Frank had significant levels of protein leaking into his urine, a condition called proteinuria. That sudsiness was his kidneys crying out for help. So, why does this happen? Your kidneys are a pair of magnificent fist-sized organs that act as your body's master filtration system. Inside each kidney are about 1 million tiny filters called glomeruli. Their job is to clean your blood, removing waste products and excess fluid while keeping essential things, like protein, in your bloodstream where they belong. Think of a healthy glomerulus as a brand new, high-tech coffee filter. It lets the liquid through but keeps the coffee grounds out. Over time, high blood sugar from diabetes acts like sandpaper on these delicate filters. It damages them, making them scarred and leaky. When these filters are compromised, they can no longer hold back larger molecules like albumin, the main protein in your blood. This protein escapes into your urine. When it hits the water in the toilet, it creates that persistent foam. I want you to ask yourself, have you noticed this? Have you ever glanced back and thought it was odd, only to flush it away and forget about it? Don't make that mistake. This isn't just a curiosity, it's a diagnostic clue. If you notice foamy urine for several days in a row, it's time to act. Call your doctor and specifically mention what you're seeing. The test you need to request is a simple one called a urine albumin to creatinine ratio, or UACR. It's a non-invasive urine test that precisely measures how much protein is escaping. Catching this early, like we did with Frank, allowed us to make immediate changes to his medication and diet, putting the brakes on the kidney damage before it became irreversible. The second warning sign is also related to urination, but it concerns the frequency, especially at night. I'm talking about having to wake up multiple times, night after night, to go to the bathroom. This condition, known as nocturia, is one of the most commonly dismissed symptoms I encounter in my practice. So many of my senior patients tell me, "Oh, that's just my old bladder," or, for the men, "It must be my prostate acting up again." And while those can certainly be contributing factors, if you have diabetes, you absolutely cannot afford to make that assumption. Waking up 2, 3, 4, or even more times a night to urinate is not a standard part of aging. It's a significant signal that your body's internal systems, particularly your kidneys, may be struggling. I remember a lovely patient, a 72-year-old retired teacher named Margaret. She came to see me because she was feeling perpetually exhausted. She was a vibrant woman who loved gardening and her book club, but she told me she barely had the energy for either anymore. She was convinced she was just slowing down. When I asked about her sleep, she sighed and said, "I'm up and down like a yo-yo all night long to use the bathroom. I guess I shouldn't have that last cup of tea." We investigated further, and it wasn't the tea. Her kidneys were losing their ability to do one of their most important jobs, and that was the real reason for her fatigue. Let's break down the science in simple terms. During the day, your kidneys filter waste and produce urine, but overnight, a healthy set of kidneys gets a signal from your brain to slow down and concentrate the urine. This allows you to sleep for a solid 6 to 8 hours without interruption. Think of it as a brilliantly designed water conservation mode. However, when diabetes has started to damage the kidneys, two things happen. First, the damaged filtering units lose their ability to respond to that signal. They can't concentrate the urine effectively anymore, so they continue to produce a large amount of dilute urine all through the night. Second, and this is the diabetic double whammy, high blood sugar itself makes the problem worse. When there's excess glucose in your bloodstream, your body tries desperately to get rid of it. The primary way it does this is by dumping the sugar into your urine. But sugar is what scientists call osmotically active, meaning it pulls water along with it. So your body isn't just getting rid of sugar, it's flushing out a large volume of water at the same time, leading to a full bladder time and time again. For seniors, this is so much more than a simple inconvenience. The chronic sleep disruption it causes leads to that bone-deep fatigue Margaret was feeling, as well as brain fog and difficulty concentrating. But even more critically, it significantly increases the risk of falls. Getting out of bed in the dark when you're groggy and half asleep is a recipe for disaster. A fall can lead to a broken hip, a loss of independence, and a cascade of other health problems. So, I want you to reflect honestly on your own sleep patterns. How many times did you get up last night? Is this a new pattern for you, or has it been slowly getting worse over the last few months or years? My suggestion to you is this. For the next week, keep a simple bedside log. A small notebook and a pen are all you need. Every time you get up to use the bathroom between when you go to sleep and when you wake up for the day, make a tally mark. Bringing this simple log to your doctor is far more powerful than just saying, "I think I get up a lot." It provides concrete data that demands attention. It helped us get to the root of Margaret's problem, and it can do the same for you. All right, we've discussed two important signs that involve changes in urination, the foaminess and the frequency. These have to do with what's leaving your body. Our third warning sign has to do with what S staying behind when it should ADTB. Swelling. Specifically, I'm talking about swelling in your feet, your ankles, your legs, and sometimes even puffiness around your eyes. The medical term for this is edema, and it's a classic sign that your body's fluid balance is off kilter, often because your kidneys are not doing their job correctly. Like our other signs, this one is all too easy to explain away. You might think, "Oh, it was a hot day," or "I was on my feet for too long," or "I must have had too much salt at dinner last night." And while all of those things can cause temporary swelling in anyone, for a person with diabetes, persistent swelling is a signal you must take very seriously. Let me tell you about David, a 70-year-old patient of mine who prided himself on his daily walks. He came to me because his wife had urged him to. He said, "Doc, it's probably nothing, but my socks are trying to kill me." He showed me how, at the end of each day, the elastic from his socks would leave deep, angry red lines around his shins that took an hour or more to fade. He'd also noticed his favorite walking shoes felt uncomfortably tight by the afternoon. His wife had added another piece to the puzzle. She'd noticed that his face, especially around his eyes, looked puffy when he first woke up, though it seemed to resolve by mid-morning. David was experiencing the textbook signs of fluid retention caused by struggling kidneys. So, what is the science behind this? Beyond filtering waste, your kidneys are the master regulators of your body's fluid and sodium levels. They work like incredibly sophisticated dam operators, constantly monitoring your blood and deciding exactly how much salt and water to release as urine and how much to keep in circulation. This maintains a perfect equilibrium. When diabetic kidney disease sets in, this regulatory system breaks down. The damaged kidneys can no longer effectively remove excess sodium. And here's the crucial rule of biology. Where sodium goes, water follows. Instead of being filtered out, this extra salt and water remains in your bloodstream. Your circulatory system becomes overloaded, and the excess fluid begins to seep out of your blood vessels and into the surrounding tissues. Gravity plays a big role here. During the day, when you're sitting or standing, that extra fluid naturally pools in the lowest parts of your body, your feet and ankles. That's why David's shoes felt tight and his socks left deep marks. Then, when you lie down to sleep at night, that fluid gets a chance to redistribute. It often settles in tissues that are soft and have more give, like the delicate areas around your eyes. That's why you might notice that morning puffiness in the mirror. This is something you can check for yourself right now. First, the sock mark test that David experienced is a simple, powerful clue. Are your socks leaving deep indentations that linger? Second, you can check for what doctors call pitting edema. Take your thumb and press it firmly but gently into the skin over your shin bone for about 5 to 10 seconds. When you release it, look closely. Does the indentation from your thumb remain for a few moments before slowly filling back in? If it does, that's a significant sign of excess fluid in your tissues. I want you to think, have your rings felt tighter on your fingers lately? Do your shoes feel snug in a way they didn't before? Don't dismiss these subtle changes. This isn't just a cosmetic issue. That excess fluid puts a direct strain on your heart and your blood vessels, contributing to high blood pressure and making your cardiovascular system work much harder than it should. If you notice new or worsening swelling, it's a clear signal to call your doctor and get your kidney function checked. We've now covered how struggling kidneys can affect what leaves your body in urine and what fluid stays behind as swelling. It's no surprise, then, that when your body's master filtration and fluid balance system is under so much strain, the fourth warning sign is a profound and persistent sense of fatigue and weakness. Now, this is arguably the most difficult symptom for seniors to recognize as a warning sign. The moment I mention fatigue, nearly every patient over the age of 65 nods and says, "Of course I'm tired, doctor. I'm not a spring chicken anymore." It is the single easiest thing to attribute to the normal process of aging. But I need you to understand that there is a vast difference between the normal, gradual slowing down that comes with age and the bone-deep, oppressive exhaustion that comes with declining kidney function. This isn't the kind of tiredness that a good night's sleep or a relaxing weekend can fix. This is a fatigue that interferes with your daily life, stealing your energy and your joy. I'm thinking of a patient named Eleanor, a wonderful 75-year-old grandmother whose greatest passion was baking. Her chocolate chip cookies were legendary in her family. She came to see me looking utterly defeated. She told me, "Dr. Clark, I can't even stand in the kitchen long enough to mix a batch of dough anymore. After 20 minutes, I have to go sit down. I feel like I've run a race." Her family just assumed Grandma was getting old, but Eleanor felt like she was losing a piece of her identity. Her fatigue wasn't from age, it was a direct result of her diabetes quietly damaging her kidneys. There are two primary reasons this debilitating fatigue happens. The first is the buildup of toxins in your blood. As we've discussed, your kidneys are responsible for filtering out metabolic waste. When their function declines, these toxins, like urea, accumulate in your bloodstream. I want you to imagine trying to run a finely tuned engine while the exhaust pipe is clogged. All of those toxic fumes would back up, choking the engine and making it run sluggishly and inefficiently. That is exactly what's happening inside your body. This buildup, a condition called uremia, poisons your energy levels from the inside out and can also lead to brain fog, a metallic taste in your mouth, and a general feeling of being unwell. The second reason is a condition you may have heard of: anemia. Healthy kidneys produce a crucial hormone called erythropoietin, or EPO for short. EPO's job is to send a signal to your bone marrow telling it to produce red blood cells. Think of red blood cells as the microscopic delivery trucks that carry oxygen from your lungs to every single cell in your body, your muscles, your organs, and your brain. When your kidneys are damaged, they can't produce enough EPO. The signal to the bone marrow becomes weak, so it produces fewer red blood cell trucks. With fewer trucks on the road, oxygen delivery plummets. This starvation for oxygen is what defines anemia, and it directly causes profound weakness, shortness of breath upon exertion, and that overwhelming fatigue Eleanor was experiencing. This is the kind of fatigue where taking a shower feels like a major accomplishment that requires a rest afterward. It's when you have to turn down an invitation to your grandchild's school play because the thought of getting ready, driving there, and sitting in the audience is simply too overwhelming. So I ask you to reflect on this. Do you wake up in the morning feeling just as tired as when you went to bed? Have you given up hobbies or social activities you once cherished simply because you lack the physical and mental energy for them? If your answer is yes, please do not accept this as your new normal. It is not. It is a symptom crying out for an explanation. When you talk to your doctor, don't just say, "I'm tired." Say, "I am experiencing a level of fatigue that is destroying my quality of life." That statement demands an investigation, which must include a check of your kidney function and a simple blood test for anemia. We've seen how kidney problems can cause fatigue by allowing toxins to build up and by preventing the production of red blood cells. We've also seen how they cause swelling by failing to regulate the body's salt and water balance. Both of these issues put a tremendous strain on your entire cardiovascular system, which leads us directly to our fifth and final major warning sign: high blood pressure that becomes difficult to control. This is a particularly important clue for those of you who are already being treated for hypertension. Perhaps you've been on the same single, low-dose medication for years, and it's always kept your numbers in a healthy range. But now, suddenly, your readings at home are consistently creeping up, or maybe your doctor has expressed frustration at your last few visits, needing to increase your dosage or even add a second or third medication just to keep your pressure from getting into the danger zone. When previously stable blood pressure becomes stubborn and resistant to treatment, it's often because there's an underlying cause, and in people with diabetes, that cause is very frequently the kidneys. Let me tell you about Robert, a 65-year-old retired accountant who was the model patient. He was meticulous. He took his medication at the same time every day, followed a low-sodium diet, and logged his blood pressure in a little notebook every single morning. For 5 years, his pressure was beautifully controlled, always hovering around 125/75. He came into my office looking worried and holding his logbook. He said, "Doctor, look at this. For the past 2 months, without changing a thing, my numbers are now pushing 150/90. What's going on?" Robert's diligence in monitoring himself gave us the crucial evidence we needed. The problem wasn't a change in his lifestyle, the problem was that his kidneys were beginning to fail, and they were actively driving his blood pressure up. To understand why this happens, you need to know that your kidneys are the absolute command center for blood pressure regulation. They do this in 2 main ways. As we discussed, they manage your body's salt and water volume. But they also produce powerful hormones, chief among them a substance called renin. When the kidneys sense that they aren't getting enough blood flow, which happens when their delicate arteries are damaged by diabetes, they make a terrible mistake. They interpret this low blood flow as a sign that the entire body's blood pressure is dangerously low. In a panic, they release a flood of renin. This triggers a chemical chain reaction that powerfully constricts blood vessels all over your body and signals your system to hold on to even more salt and water. This creates a devastating and vicious cycle. The damaged kidneys raise your blood pressure. That new, powerful high blood pressure then acts like a relentless hammer, pounding against the fragile, microscopic blood vessels and filters inside the kidneys, causing more damage. This new damage, in turn, causes the kidneys to release even more renin, driving the pressure even higher. It is a dangerous feedback loop where the kidneys and high blood pressure conspire to destroy one another, spiraling downward together. This is why monitoring your blood pressure at home is not just a good idea. It is an absolute necessity if you have diabetes. That simple cuff is one of the most powerful health tools you can own. For most people with diabetes, the goal is to keep your blood pressure consistently below 130/80 mm domain. But you should always follow the specific target set by your doctor. I want you to ask yourself, have you or your doctor had to increase your blood pressure medication recently? Have you noticed a new, upward trend in your home readings that you can't explain? If the answer is yes, don't just accept a new prescription and move on. You need to ask your doctor a direct question. Could my kidney function be the reason my blood pressure is suddenly so hard to control? So, we've now walked through the 5 key warning signs: the foamy urine, the frequent nighttime awakenings, the swelling in your ankles and legs, that deep, persistent fatigue, and the high blood pressure that just won't seem to cooperate. Recognizing these signs is the essential first step, but it's what you do with this knowledge that truly matters. This next part is all about translating that awareness into decisive action. It is about knowing exactly when to call your doctor and what to say when you get there. Let's start with urgency. My general guideline for my patients is this: if you are experiencing any 2 or more of these 5 symptoms together, it's time to make an appointment. For example, if you're noticing both foamy urine and worsening fatigue, or if your ankles are swollen and your blood pressure is creeping up, don't wait for your next scheduled 6-month checkup. Call the office and tell the nurse you need to be seen sooner because you're concerned about your kidney health. The same rule applies if you experience a sudden and dramatic worsening of any single symptom. If your feet are a little puffy one week and severely swollen the next, that's a signal that requires prompt attention. Now, I also need to be very clear about the symptoms that constitute an emergency. If your kidney function declines rapidly, it can become life-threatening. If you experience any of the following, you need to seek immediate medical help by going to an emergency room or calling 911. These signs include severe or rapidly worsening swelling, especially if it involves your face and hands' shortness of breath, which can indicate fluid backing up into your lungs, chest pain, or pressure as your heart strains against the fluid overload or sudden confusion, extreme drowsiness, and difficulty concentrating, which are signs that toxin levels in your blood have become dangerously high. These are not wait-and-see symptoms. They are your body's fire alarm, and you need to respond immediately. For the less urgent but still very important scenarios, the key is to go to your doctor's appointment prepared. This is how you transform from a passive patient into an active partner in your own health care. First, bring your data. Remember the logs we talked about? Bring your week-long log of how many times you get up at night. Bring your notebook with your daily blood pressure readings for the last month. And make a simple written list of your symptoms. Instead of just saying, "I'm tired," write down, "Fatigue is preventing me from doing my grocery shopping." This kind of specific information is incredibly valuable. Next, you need to know which tests to discuss. You can, and should, advocate for your health by knowing what to ask for. The 3 key tests for kidney health are, first, the urine albumin to creatinine ratio, or UACR. This is that simple urine test we mentioned that checks for tiny amounts of protein leaking out. It is the best test for detecting the absolute earliest stage of kidney damage. Second, a blood test for serum creatinine. Creatinine is a normal waste product in your blood that healthy kidneys easily filter out. If your creatinine level is high, it's a sign that the kidneys are not cleaning your blood effectively. And third, your eGFR, which stands for Estimated Glomerular Filtration Rate. This isn't a separate test, but a crucial calculation based on your creatinine level, age, and other factors. The easiest way to think of your eGFR is as a percentage score for your kidney function. A number above 90 is great. A number between 60 and 90 may be normal, but requires monitoring. Once your eGFR drops below 60 and stays there for 3 months, it signifies chronic kidney disease. Finally, go in with a few essential questions written down. Ask your doctor, what is my eGFR number and what does it mean for me? How often should I be getting these kidney screening tests done? And a critically important one, are the medications I'm taking for my diabetes and blood pressure the best ones available for protecting my kidneys? This conversation is the single most powerful step you can take to get ahead of any potential problem and protect your future. Having that informed, proactive conversation with your doctor is a critical turning point. But the journey to protecting your kidneys doesn't just happen in a clinic every few months. The real, day-to-day work happens at home. It's about creating a routine of awareness. It's about you becoming the chief executive officer of your own health. And the good news is, the tools you need to do this are simple, accessible, and incredibly powerful. So let's talk about the essential at-home monitoring tips that can make all the difference. The first and most important pillar of your home monitoring plan is, without question, blood sugar control. We've talked a lot about the consequences of kidney damage, but we must never forget the root cause: high blood sugar. Every time your blood glucose level spikes and stays high, it's like sending a little shockwave of inflammation and scarring through those delicate filters in your kidneys. Your daily blood glucose meter is your single most important tool in this fight. It's your truth teller. It gives you immediate feedback on how your body is handling the food you eat, the exercise you do, and the medication you take. Know your target numbers, and for most seniors with diabetes, the goal for your long-term blood sugar, the HbA1c test, should be under 7%, or whatever specific goal your doctor has set for you. Consistent control is the foundation of kidney protection. The second pillar, which is equally important, is blood pressure management. Remember that vicious cycle we discussed? High blood sugar damages the kidneys, and the damaged kidneys then cause high blood pressure, which in turn causes even more damage. Breaking this cycle is non-negotiable. This is why a reliable home blood pressure monitor is an essential piece of equipment. I want you to make checking your blood pressure a non-negotiable part of your morning routine, just like brushing your teeth. Before you have your coffee, before you take your morning pills, sit quietly in a chair with your feet flat on the floor for 5 minutes and get an accurate reading. Log it in that notebook we talked about. This daily habit transforms a fuzzy picture into a high-definition understanding of what's happening in your cardiovascular system. The third pillar is keeping a simple symptom diary. Our memories are faulty, especially when it comes to subtle, day-to-day changes. A symptom diary provides objective data that helps you and your doctor see patterns you would otherwise miss. This doesn't need to be complicated. Get a simple notebook, and each day just jot down a few quick notes. You could rate your fatigue level on a scale of 1 to 5. Make a note of swelling. For instance, sock marks were deep today, or eyes felt puffy this morning. Note any instances of foamy urine. And finally, part of this daily check-in should be your weight. Your bathroom scale is one of the most sensitive detectors you have for fluid retention. A sudden weight gain of 2 to 3 pounds in 24 hours or 5 pounds in a week is almost never fat, it's fluid. It's a clear, numerical sign that your body is holding on to excess water, which could be an early warning from your kidneys or heart. I have patients who create a simple chart in a notebook. It takes them less than 2 minutes each morning to log their weight, their blood sugar, their blood pressure, and a quick energy rating. When they come to see me, they bring this log, and it gives us a perfect, data-rich snapshot of the past 3 months. We can see trends, connect dots, and make intelligent decisions together. This isn't about creating anxiety, it's about building confidence. This simple, 2-minute daily ritual puts you firmly in the driver's seat of your own health journey. Monitoring your health is your defensive strategy. It's how you spot problems early and intercept them before they can cause irreversible harm. But healthcare isn't just about playing defense. Now, we need to talk about your offense. These are the proactive, powerful prevention strategies you can start using today to actively shield your kidneys and promote their long-term health. First and foremost, the foundation of all kidney protection in a person with diabetes is relentless control of your blood sugar and blood pressure. This is the non-negotiable cornerstone of your entire plan. All the monitoring we just discussed is designed to give you the data you need to achieve this. It means taking your medications precisely as prescribed, every single day, without fail. For many people with diabetes, doctors will specifically prescribe blood pressure medicines from a class called ACE inhibitors, or ARBs. These are special dual-action drugs that not only lower your blood pressure but also have a unique protective effect on the kidneys themselves, reducing pressure inside those tiny filters. If you aren't on one, it's a critical question to ask your doctor. Second is adopting a kidney-friendly diet. This doesn't have to be complicated or bland. It boils down to a few simple principles. The most important is to lower your sodium intake. Think of salt as a sponge that forces your body to hold on to excess water, which directly raises your blood volume and blood pressure. The biggest sources of salt aren't from the salt shaker, they're from processed foods, canned soups, frozen dinners, and fast food. By cooking more fresh meals at home and using herbs, spices, garlic, and onion for flavor, you can dramatically reduce your sodium load. It's also wise to moderate your protein intake. While protein is essential, very high-protein diets can make damaged kidneys work harder. Focus on sensible portions. A piece of chicken, fish, or meat about the size of the palm of your hand is a good benchmark for a meal. Third, you need to hydrate wisely. For most people, drinking plenty of water throughout the day is one of the best things you can do for your kidneys, helping them to flush out waste products and toxins effectively. However, it's crucial to note that if you have already been diagnosed with more advanced kidney disease, your doctor may actually need to restrict your fluid intake. This is a perfect example of why personalized medical advice is so important. Fourth, you must be smart about other medications and supplements. This is a big one. You need to avoid a class of common over-the-counter pain relievers called NSAIDs. This includes ibuprofen, which is sold as Advil and Motrin, and naproxen, sold as Aleve. Chronic, long-term use of these drugs can be directly toxic to the kidneys. For general aches and pains, acetaminophen or Tylenol is usually a safer choice, but you should always discuss this with your doctor. Also, be very cautious about high-dose protein powders and certain herbal supplements, which can put a strain on your kidneys. Always disclose every single thing you take to your doctor and pharmacist. Finally, stay active. You don't need to train for a marathon. The goal is gentle, consistent movement. A brisk 30-minute walk each day can do wonders. It helps your body use insulin more effectively to control blood sugar. It helps lower your blood pressure, and it improves overall circulation. All of these benefits directly support the health of your kidneys. So, let's bring it all home. Remember the clues we discussed: the foam in the toilet, the frequent trips to the bathroom at night, the swelling in your ankles, the fatigue that steals your energy, and the blood pressure that refuses to be tamed. These are not just random quirks of getting older, they are your body's early warning system. By listening to these signals, by monitoring your health diligently at home, and by putting these protective strategies into practice, you can fundamentally alter the course of your health. You are not a passive bystander in your journey with diabetes. You are the most powerful person on your healthcare team. Catching these signs early is the key to protecting your kidneys, preserving your independence, and living the long, healthy, and vibrant life you deserve. Thank you for your time and attention. If you found this information valuable, I encourage you to subscribe for more senior health advice you can trust. Please share this with anyone you know who is living with diabetes. It could make all the difference. Be well.